Welcome to everyone. I know we still have some people probably coming in, but I want to begin by welcoming everybody to today's session as we look at the issue of raising jails. We're going to be talking about the building of jails in North Carolina and related issues. Wanted to introduce you initially to who we are. Carolina Public Press is a 10-year-old organization. We're based in Asheville, but we cover the entire state. We're a nonprofit, nonpartisan, independent provider of news. We look at in-depth and investigative reporting on public interest issues in North Carolina. We want to look at issues that affect people's lives in North Carolina. This year, we are celebrating our 10th anniversary. We were founded in 2011, and we are currently having a 10 for NC conversation series. This is part of that celebration, and this is one of the series of forums that we're having in relation to that project celebrating our 10 years of work covering news in North Carolina. We ask that everybody who is participating as an attendee would stay muted and keep your video off. You'll be able to participate through chat if you have questions or comments. And then, of course, I want to start by introducing our panelists to you. So our panelists today include Felicia Arriaga. She's a visiting research scholar at the Princeton School of Public and International Affairs and assistant professor of sociology at Appalachian State University. Amanda Hughett is assistant professor of legal studies at the University of Illinois Springfield, and she did extensive work previously on incarceration issues in North Carolina. Kristie Puckett Williams is with the Statewide Campaign for Smart Justice. She's the manager of that campaign for the ACLU of North Carolina. Jessica Smith is with the W.R. Kenan Jr. She is the W.R. Kenan Jr. Distinguished Professor and the Director of the Criminal Justice Innovation Lab at the School of Government of the University of North Carolina at Chapel Hill. And then with us, we also have Jordan Wilkie, who is a Carolina Public Press reporter. He's a Report for America core member, and he was the author of a recent investigative series that we published called Raising Jails, looking at the same issues we're going to be discussing today. I'm your moderator. I'm Frank Taylor. I'm managing editor of Carolina Public Press. With that, I'll begin looking at some questions that we have. We received a number of good questions from people in the community, and I will get to some of those. Some of these I will kind of synthesize questions that are similar, and I also want to just kind of walk people through what it is we're looking at to introduce it. Jordan, you did a lot of work with this series. Do you want to kind of talk with us about the dynamics of what we found in the 4 stories in the series? What did we see with why jails are being built and some of the concerns that are raised in that process?
Well, I mean, there seem to be a number of reasons why jails are being built. Counties are telling me that they're overcrowded. That issue could be addressed by some policy changes that maybe could reduce jail populations instead of construction. We've seen counties decide to do that. We've seen counties say, their facilities are quite old and therefore they need to build. That was certainly the case in Orange County, where their initial facility was built in 1925, and they recently built a new facility and are in the process of transitioning over. And they're actually taking a 2-pronged approach, which some counties take, where they're building a new jail and then also creating new policy and new programming to hopefully keep part of that jail empty. There are other issues where maybe a jail isn't being properly maintained, and the Department of Health and Human Services has oversight. And so they go in and they say, well, there's various issues with the conditions of this facility. A common solution is to then build. And sort of backing all of this decision to build, we found that there is a process by which counties thinking about building a jail will consult with an architecture firm and will ask that firm to provide recommendations for, projections for how large the jail is going to be, how many people they're expecting to fill the jail with over the next 20, 30, 40 years. And then that firm, will say it needs to be so large, and then we'll come back. And if a county decides to build, that firm will then, bid on the opportunity to design that jail for the county. And last but not least, we also see that some counties are thinking that, if they do have to build a jail, if they do end up building a jail, they calculate for how they're going to use some of their beds to house for people for other jurisdictions. the U.S. Marshals being a primary funder, a source of money that comes into counties by holding people for the federal government in their jails. And there isn't a really clear explicit connection there that I found about, we're going to build a jail with an extra 100 beds specifically for the feds. But there's a number of counties told me that yes, if they do decide to build, they are going to try to fund some of that debt and construction cost by housing people for other jurisdictions. Thank you,
Jordan. So I want to ask kind of everybody here on the panel this question that we found that as counties are saying, well, we're going to build a jail. We think we might need a bigger jail. We have one, but we want to replace it, or we want to build a bigger one. We see some issues. And so they go and hire an architectural firm, and the architectural firm is very often then hired later to build the jail that they ended up recommending. Do we see any problems? Anybody on the panel want to step in and address that? Does that seem like a good system?
Well, I think there's a lot to unpack there. And I mean, one of the things that we found is whether or not it's an architecture firm, that counties are looking at these needs assessments that are done by the architecture firm. In many cases, not every single case. And the assessments may be lacking a little bit in terms of the local context. So something that I would like to hear from, especially from Professor Smith, of when you're looking at who's in a jail and thinking about whether or not that person needs to be in a jail, just some metrics that people might want to consider. And Professor Smith, I know you've done not studies on jail construction, but work on especially pretrial release and looking at numbers of failure to appear and things like that. Could you just talk to us a little bit about who's in jails, what decisions we make about keeping folks in jail, what impact that has on public safety and the like?
Sure. And I just want to clarify at the outset, at the School of Government, we're nonpartisan and non-advocacy. So I'm not going to weigh in on how jurisdictions should do it, but I can share some of the conversations that I have had or would have with a jurisdiction that was looking for help in terms of dealing with their jail population. And, one thing that we would recommend they look at is do an analysis over time of who is booked into the jail. What are they booked into the jail on? How long do they stay? All kinds of demographics about who they are, as well as the kind of needs and other issues that are presented by that. And so a lot of times that kind of work reveals some things about the functioning of both the local criminal justice system as well as broader systems. For example, one thing that sometimes comes to light is that people who don't have access to behavioral health treatment are entering the criminal justice system and are being housed in the jail when so for example, people who are being repeatedly arrested on maybe disruptive charges because of untreated mental health issues, they go into the system, they come out of the system, it's usually a low-level offense, they go right back into the community, nothing's been done to address root causes of behavior, and they go back into the system, and the taxpayers are picking up the tab on all of that. So one question that communities might want to ask is if we have people who are entering the system and who are entering repeatedly or staying for periods of time in the jail because of behavioral health issues or substance abuse issues or homelessness issues, because there are people who, because of poverty, end up getting charged in some jurisdictions with crimes like sleeping in public parks and other types of things. So sometimes that causes the community to take a step back and say, well, do we want to be spending this money in the jail? Is it really solving our problem? Or could we more effectively deal with those problems with community resources? Another thing that sometimes comes to light when folks look at their jail populations is they realize that perhaps they're detaining large numbers of people charged with really low-level offenses, and perhaps that they're getting detained not because they're dangerous to the community, but because they can't pay the bail conditions that are associated with their cases. And so sometimes that causes jurisdictions to look at, is this the way we want to be using the jail? Is this the way we want to be running our pretrial system? And so doing that kind of analysis can really create opportunities for what I think most leaders and most communities want, which is, number one, improved public safety, because that is what the justice system is about. And then opportunities for people to flourish, communities to flourish with regard to all people, because we find that sometimes jail detention of low-level people actually undermines the health and wellness and safety of the local community. So that type of examination can be quite helpful.
And to be clear on this, as we talk about counties in North Carolina, certainly there are laws in place, but a lot of this is done at the local level, and there's not necessarily guidelines. For instance, the choice to go with an architectural firm to recommend a study to assess the jail, that's being done at the local level. There's not necessarily a state mandate to do that, right?
Yeah, that's certainly correct. And to follow up on what Professor Smith said, I didn't see anything that she just mentioned actually discussed in any of these needs assessments. And while that is an inadequacy of a needs assessment, it is ultimately the county commission that is responsible for making the decision to build a jail and to investigate whether or not it needs to build, wants to build, what kind of services it wants to provide in the jail or in the community. And so this is not, this issue does have some responsibility laid at the feet of our elected officials.
And to your original question, Frank, is this a good practice? It's a horrible practice. I mean, to Jordan's recent point, which is they're not even assessing the things that they would need to assess to determine the size of a jail. They're only assessing the ways that they can continue the profit making that happens when you employ a private firm who has a vested interest in increasing the size. I don't think an architectural firm is going to come and say, no, actually the size that you have is adequate and you could make it smaller. They're always going to recommend that it be bigger and that it be better and that it be modernized. And so I think the initial thought process behind this is not rooted in the community. And so just to push back a little bit on what Professor Smith said, this system is not about justice. This system is about punishment. And so if we are seeking justice, we wouldn't have anyone that is incarcerated due to their homelessness, due to their poverty, due to their lack of resources. If it were justice, those people would have resources made readily available to them. But because we are investing in punishment, we are readily making sure that punishment is available to every single person who falls into those categories.
Thank you. As we think about this, and I see a lot of questions coming into the chat, we had some preceding questions about this too. People are really interested in what can communities do differently? Where can communities put their resources to reduce the need for jails? What other options do they have? Could some of you talk about other models that you see that are working, either things that have been tried in North Carolina or have been tried elsewhere that offer real opportunities for hope to be able to stop building bigger jails indefinitely?
I mean, Frank, that's such a loaded, what it really takes, or do you want what it takes, like, if we want to be performative and make changes?
I'm not talking about systemic changes. I want to get to that in a minute, but I'm just talking about local level. With the system we've got in place right now, what can be done at the local level to try to implement changes so that more resources can go to other places to help this situation?
I mean, well, the obvious one is to reallocate resources away from police and policing that is already racially disparate and targets poor Black, brown people, succinctly targets poor Black and brown people successfully every day. And we would redirect those funds to address the issues that Professor Smith laid out. So if you're saying about homelessness, then how do you address that? A person gets a house, substance use, treatment, treatment that looks like treatment to them, right? Because we have this real habit of recreating carceral spaces in spaces that are supposed to be helpful to people. So if your treatment facility or your transition house runs just like a prison, or your domestic violence shelter runs just like a jail or a prison, is that helpful? Is that transformational? Or is that just re-entrenching punishment and harm in the systems that are supposed to be helpful, in the resources? And so if we do that, then we have to have a whole recentering on who's the expert. The experts aren't me, the college professors, and the people who pontificate and opine. The people who are entrenched in the system who are struggling every single day, being warehoused for their issues, would be the people who we would seek those answers from. They would be the people who would be on this panel instead of us. And so it's going to take a radical reframing of who are the experts on jails and prisons and incarceration. And I would challenge everyone to redirect their energies around expertise to the people who are currently and or formerly incarcerated.
Yeah, and I just want to add to that. Kristie and I had a great conversation yesterday with one of a fellow that we're working with on reentry, specifically in Cumberland County. And so one of the things that we were trying to dig into and understand a bit more is sort of where is the funding for reentry programs going, and how does that sort of like substantively get down to some of the community organizations who have been holding the work of reentry, even if there isn't a reentry council, right, in that particular location. So I think that that's obviously like a place, once someone is incarcerated, that more support needs to be going into. But then even before, sort of, right, we're sending people to jails, thinking about what are the alternatives, right? I think Professor Smith did mention sort of not necessarily incarcerating folks for low-level misdemeanors or low-level sort of charges. And so obviously I think that that's a pretty important one. And I will say too, I think one of the things that I've been looking at most recently is how during the pandemic, especially early on in the pandemic, how did we shift some of the way that we sort of, right, are doing policing? And we did see in specific ways across the state where there were I guess I would say relaxation, or at least there were some changes around citations instead of sort of incarcerating people, right? I think we've seen that that's returned to quote unquote normal in this sort of realm, but we did see, right, and I think this speaks to some of the pieces that were mentioned and reported on, is that we did see sort of a small decrease in the population, right, and some efforts to actually release folks from jail. So I think we have the tools, right? I don't think that we need to be in a pandemic moment to be able to suggest to agencies that they cite or think about some not innovative, because they don't seem innovative at all. They just seem like this is logical, right? Which I think ends up protecting individuals within the community. And I also want to say too that I think the question that I'm more sort of concerned about is community safety and not necessarily public safety, right? So the questions of like what keeps communities safe is different than what keeps a certain segment of the population safe, which I think is often sort of tied into the way we talk about public safety, right? Is that those are crimes of people who are often discriminated against because we're trying to protect white supremacy, right? In some ways, right? We're trying to protect a certain type of racial order within our country and within the state too.
I would love to hear some of the folks on this panel who are sort of contemporary policymakers talk a little bit more about bail reform and what's going on with that in North Carolina. Because of course, when we're talking about people who are in jails, we're overwhelmingly talking about people who are pre-trial detainees, right? People who are incarcerated before they're technically convicted, right? And as Jordan noted in the article, right, 95% of people in North Carolina who are in jails are held on monetary bonds, right? And bail reform, calls for bail reform have really picked up speed in states around the country right now. And I wonder if anybody could speak to what's going on with bail reform in North Carolina.
Just before anybody else jumps in, I just want to echo something you addressed there, because we're seeing what seem to be results from that too. We're seeing lower levels of incarceration in areas that have made some changes there, in particular counties, and we're seeing other counties kind of go the other direction. But generally speaking, crime is down. When you ask people why are people being jailed in a lot of these counties that are seeing a big boom in population, it's not because it's not because crime is up, it's because primarily of substance abuse related issues. And so it seems like bail reform is having as an effective measure in some places, but I'd love to hear from some panelists talking about that.
I mean, as a person who was incarcerated on a very large bond for my substance use disorder and forced into a plea bargain because my back was up against the wall, bail is an issue. I know that Professor Smith has done lots of work to educate magistrates and judges across the state. We were on a tour with the Attorney General's office trying to highlight some of that work and the findings that we found. But there is a general resistance, right? Because culture change takes a while. And we've only been having these conversations in the last strongly for the last 4 or 5 years that I can recall. And we have seen some of those changes. So we don't see as many people incarcerated in the cities that have made those changes. But what we see in the other direction, to the other point, is a more entrenched adherence to, but even in Mecklenburg, somewhere where I live, which is one of the largest resource counties, and they made changes, but I've court watched and saw a judge that said, I know what the new bail policy says, but I'm going to set this bail anyway. And so even if you make the changes, our law here in North Carolina, 15A 534, is not a bad law. The issue is the implementation of that law, or the deciding to not implement it in the way in which it was designed, right? And so these are conscious decisions that people in positions of power make to ignore or to hyper-focus on certain things. And so we have to challenge that culture, again, of that punitive punishment. And what do we actually want? Community safety. And if we actually want that community safety, then punishing people and holding them and warehousing them. Because as someone who, again, was locked up for my substance use disorder, when they let me out, guess what I did? Went right back to the house I left that you picked me up from and started using again. So like, you didn't disrupt anything. All you did was push pause. When I hit the streets, we push play again. And so like, if you really want there to be a permanent pause on my drug use, then you're going to have to do more than sit me in a warehouse, give me no care, increase my trauma, which is also a part of the reason why people use substances. And so when we talk about how do we address the substance use epidemic, then you have to be willing to address the behavioral health crisis that we have in this country and the lack of access to healthcare and resources. But we have an inordinate amount of resources to police and to policing and the militarization of police. So when you think of those imbalances, then yes, North Carolina is regressive in so many ways. We have a regressive tax where the poorest people here pay the most of their income. We also have a regressive tax on incarcerated people where the poorest people pay the highest cost, which is they lose the custody of their children, they lose their homes, they lose their jobs, they lose their connectivity. But most importantly, they lose their humanity. And in that loss of humanity, what do we gain as a society? We gain absolutely nothing, but a shell of a person that is coming back, potentially a shell of a person with a whole lot more trauma and a whole lot more needs that we still don't have the resources to address when they come home. And so it is just really a cycle that we have to make conscious decisions to disrupt and interrupt.
Yeah, I want to address one. Go ahead, sorry.
Yeah, so just to kind of come back to a couple of points, that in my opinion, the single largest driver of incarceration, period, is the scope of the criminal justice system. And I think it is important for us to sort of step back and think about what is in the criminal justice system. And for folks who don't know, in the year 2000, there were about 1.5 million criminal charges. The vast majority of those were misdemeanors. So that's about 87%. And an even larger slice of that were nonviolent offenses. So almost 92% of all of those 1.5 million charges were misdemeanors. Even when we look in the felonies, most of them are nonviolent. And to the points about services that are needed, over a third of those felony charges are related to drug charges. So there's no question that substance use is driving the system. When we look at the misdemeanor charging, which again makes up the great bulk of the system, that the charges that are fueling people, that people can land in jail on the front end, they can land in jail because they miss a court date, they can land in jail because maybe they're serving a misdemeanor sentence. Again, the vast majority of those are nonviolent, and the majority of those charges are non-impaired driving traffic offenses. So some of this information has really caused stakeholders to have conversations about, who do we want to include in that criminal justice net? Do we want to process people? And along those lines, they're looking at, what are the top nonviolent misdemeanor charges that are in the system? And the number one misdemeanor charge in the system is speeding. That is a road safety issue for sure, at around 275 thousand charges, but the next one is driving while license revoked non-impaired, coming in at about 139,000. That's a charge that happens when someone loses their license because they missed a court date or they couldn't pay the fines and fees associated with their charge. And so the communities are asking the question about, is this what we want to do with our criminal justice system? And there are a lot of discretionary choices that can be made by officers about whether they want to charge, by prosecutors about whether they want to prosecute. And that really is the biggest thing that is going to impact the system. But once you decide who is going to be in the system, there is an issue about thinking about your bail systems. And I think that Kristie's right in that it has really only been maybe in the last 5 or 6 years that people have come to understand the profound ways in which our current system has ripple effects throughout the community in terms of undermining public safety and tremendous cost and fairness issues. And there are opportunities that communities are doing across North Carolina, not just in the urban areas, but also in rural communities to make improvements to the system.
If I may follow up on both something that Professor Smith said and that Kristie said, I hear from jail administrators around the state that the majority of the people in their facilities are there related to drug charges, related to mental health issues. And I hear that, we build a new jail, we're going to have a larger jail, it won't be overcrowded, we'll now have programming space, and this will help us then provide these services that we weren't able to adequately provide before. And so, Kristie, I was hoping I could hear from you. When you were incarcerated, did you have any services that were provided in the jail related to substance use? Do you feel like those would have been effective? And then I would also like to hear some of the history around how jails are used and what is an appropriate use of jails in criminal justice system, if Professor Hughett would be able to speak to that.
So no, to your answer, I again received no care in any of the times that I was incarcerated, but one of the most significant times was when I was pregnant, and come to find out I was pregnant with twins after I delivered them. I received no care, no prenatal care, not a prenatal vitamin, not a visit to the nurse, you know what I'm saying? Nothing. And so, well, I did go downstairs to see the nurse, but I didn't go see the doctors. I didn't move outside of that facility to go have an ultrasound, to have, anything. So when you talk about that's basic care, is prenatal care. When you're asking for someone to be treated for something that we can't see, you don't look sick, you know what I mean? What's prioritized inside of a healthcare facility, inside of a carceral facility is death. If you are dead or dying, then you receive treatment. Anything other than that, that's the measuring stick. Like, are you dead? Are you dying? Are you bleeding? Is death imminent? If death is not imminent, then you are just cast aside. And so, no, there is no treatment. And why do you have to be incarcerated to get it? Like, if you know I need substance use, if you know I need mental health beds, why not make those available in the community with peers who understand? Because DOs and COs don't have the experience. They know how to lock you in a room and to check on you, supposedly, every 40 minutes. That doesn't even always happen, right? And so they don't have the skill to assess. Peer supports are in the community. People like myself who have come through, who are now on the other side, who are readily available to help people and assist people and help people to recover and to heal. And that is not the point or the purpose of incarceration. And so that's why treatment can't exist in a carceral space, because the point of a carceral space is to punish, not to heal. And people need healing, and they need connections. They don't need to be disappeared from their community. They need to be a part and feel seen and heard and valued by their community, not ostracized and removed from their community in order to heal. So even the setup itself doesn't promote healing. Even the way that we administer mental health treatment outside of a jail does not promote healing, because it is everything we've created in this country has been based off of colonized, imperialistic, capitalistic foundations. And until we are unearth all of that and decolonize all of that, we will continue to reinstitute and reframe harm and call it something different. It's prison by another name, whether you call it a domestic violence shelter, a rehab facility, or a mental health facility. If access is controlled, if I don't have agency and autonomy over my body, then that is when we have a real problem. And that is what we're combating, is the agency and autonomy of people who are substance using, who do experience mental health. Because just because I have a substance use disorder, does that mean that now you have agency and autonomy over my body? Who says that I can't use substances? It's my body. Who said, why is that a crime? We need to investigate all of these things, because all crime is not harmful and all harm ain't a crime. And so, like, what are we trying to address? Are we trying to address crime? We're trying to address harm? Like, it's not synonymous. And punishment is not synonymous with justice. And we really have to be really nuanced about our language and about our intentions, and be really, in order for us to really adequately address these issues.
Yeah, thank you for that. Yeah, I mean, in some ways, I think the problems that we see today are not new problems. Like, when we look at the history of jails, especially in early America, were sort of catch-all places, right? They often shared spaces with poorhouses. They often housed people with physical and mental disabilities. That was always sort of the origin there. They didn't really begin to have standards until the late 1960s. And before that, they sort of remained just the Wild West of incarceration, institutions in which local sheriffs, local officials had really broad discretion to sort of run these jails however they wanted. And even after standards were created in the late 1960s, they still remained these sort of institutions that were outside of the public eye. And sort of the worst kinds of abuses happen in jails when nobody's watching, or when they think nobody's watching, right? And so that's sort of a key lesson from the past about the ways that we should be paying attention, which means writing letters, having protests, making sure that the people who are in charge of these facilities know that we're paying attention to what's happening on the inside, right? And I think too, jails have always been these locations that housed, our poor, our disabled, right? But in the 1980s too, we began to invest more and more in these carceral institutions. At the same time, we were defunding a lot of these social safety net programs that were envisioned as opportunities to take care of the most vulnerable among us. And so it sort of exacerbated, long-standing problems of these jails serving as these catch-all warehouses for marginalized folks among us.
As we talk about marginalized groups, there's one group I want to mention that we haven't addressed directly, I don't think, in what we've heard today. But we see that when we hear about these jails in the counties that are housing people who've been detained elsewhere, it's not just people who have been arrested in the federal system, but we also see people who have been detained because of their immigration status. I'm wondering, is there a sense of how big of a factor that is, and how serious of a problem that is with the treatment of these people in jails in North Carolina? What is the role of jails in relation to immigrant detainees?
I'm happy to jump in, and then
Please.
Others, please feel free. Yeah, I mean, I think we sort of see it in Jordan brought up in one of the pieces, the holding for federal marshals. And I think actually that's been probably like one of the bigger discussions around immigration, specifically in Mecklenburg County, right? So folks remember back in 2018, I think we were having these really deep conversations about ICE enforcement at the local level, ICE sheriffs having contracts with ICE. And so I think Mecklenburg County, Wake County decided to stop using one particular type of immigration enforcement program. And I say that because I think there's also the misconception, and in the past sort of 2 legislative sessions, the misconception that we've heard at the state level too, that local law enforcement isn't cooperating with ICE. And factually, like that's just inaccurate. So if people don't know, every jail in North Carolina, they have the ability to send information to ICE. So when someone gets booked within the jail, and this is consistent for the most part across the country as well. That information gets sent to different databases, right? Different people who look at them in those things. And so every jail in North Carolina does that currently. Like everyone is able to send that information to ICE. It's really up to ICE to decide what they're going to do, right, about that particular case. There are places in the state where they've actually added some additional support. We've seen the sort of increase of this particular program that's called the 287G program, which was the ongoing debate for Wake and Mecklenburg County back in 2018, where now I think we have close to 12 of these programs across the state. In 2019, thanks to a lot of things that are going on in Florida, we saw the creation of a sort of a different version of the one that we saw in North Carolina before. And so that has been something that a lot of sheriffs in North Carolina have been eager to do, while they're also trying to push state legislation to force sheriffs to cooperate with ICE, right? Unfortunately, with some of the partners, Kristie's partners over the ACLU, with a bunch of different, about 50 or so organizations across the state, we've been able to actually push back on that type of state legislation, right? And provide some of the context for that. I will say too, that one of the things that actually, the first thing I started looking at when I started doing this research was the influence of ICE and some of these sort of the money that was actually occurring, that was actually sort of being transferred from ICE as reimbursement, as promises. I think that that's one of the things too that I think is similar, right? Is that in some places, and I forgot which county exactly, that the sort of promise, the prospect, and back in sort of 2006, 2008, the possibility of getting funding to hold immigrants was really enticing for sheriffs, right? And so I think we don't talk enough about that. Over the years, the actual like reimbursement and I think the profit has changed somewhat when it comes to immigration enforcement, although we still have places like Alamance County, I think is always the sort of boogeyman when it comes to this. Alamance County Sheriff is the one who I think is always gung-ho about the possibilities of holding immigrants and what that means, which does also dictate how many people are coming into the jail, right? So I think the saying goes, if you build it, they'll fill it, right? And so I think for us, that's always a concern about what sort of that means. And unfortunately, when we've done this sort of round of information requesting when it comes to COVID-19 policies across the state, and some of the sheriffs were not eager to answer our questions about ICE, even though we can check sort of national databases that we know that they are holding immigrants. I always say trust community members. If a community member calls me to tells me that ICE has picked up their loved one from a local jail, I'm going to trust that person, right? And so I think we have to consistently monitor, as folks have said, have to monitor what's going on at the local level, because those are local level decisions, right? Those types of ICE conversations, the conversations about contracts, those happen in county commissioner meetings often, right? If they do, right? I'm not saying they always do, because sometimes they don't, but that is like one way that we as people who are either not impacted or also impacted can monitor this, is making sure that we're sort of engaging in those meetings, even when it's uncomfortable. Because I also will say, I've been in plenty of rooms with just sheriff officers and sheriff deputies and ICE officials, and it's also not comfortable as a woman of color, as a person who has family members who are undocumented. Those are not places that I feel welcome in, but I do think it's a responsibility for folks who particularly are impacted, that we can sort of be involved, is making sure that we're sort of raising the alarm on these things on a regular basis while we're following the lead of people who have been directly impacted.
One of the things go ahead, sorry.
I just wanted to briefly add on a point. I mean, a number of folks have talked about how difficult it is to learn about what's happening in individual county jails. And I think this is true in many ways, not only what is happening in terms of conditions of confinement and how people are experiencing incarceration while they're there, but just finding regular data across all the jails is incredibly difficult. I know that Professor Smith and I talked about this a little bit. I know that another source on the series who's not a panelist today, Catherine Brodensky, who's a PhD student at Duke, is working on what it would take to really create a consistent database of information across county jails. And as it stands, I mean, it's just, as a reporter trying to find out information across the state, it's very, very difficult to find information from all these counties, let alone information that is data that is collected in a consistent way.
Thank you, Jordan. Go ahead.
I just want to highlight, as we talk about ICE and the jails housing, various kinds of folks for different agencies, both federally and at the state level, that I thought, one of the most important things that came to light in the reporting that you did, Jordan, was the fact that while, these jails housing people offset the cost, it's not a profit, right? And I think that that is something that we often lose sight of, right? That building jails always comes at a cost, right? That that we can try to offset that cost in sort of morally questionable ways, right? But it is still money going toward incarcerating people, right? And I think that that's important because jails as well as prisons have sort of a long history of obscuring how the financing works, right? And my own work, I spend a lot of time writing about prison labor, and prison labor is another one of those institutions where, it might offset the cost, but it's not sort of direct money for the state. And so I think it's important that we be clear about who's making money, where's money coming from, how much are state taxpayers paying for incarcerating people at the local and state level.
No, that's a really good point. Go ahead.
Yeah, and something that someone pointed out to me recently, in the story I talked about how counties are trying to save local taxpayer dollars by housing people from other jurisdictions, but the people they're housing for are the federal government and the state government. So ultimately taxpayers are still footing that bill. It just depends on how large of a pool is that bill coming from.
Something that I noticed in the reporting related to this that I wanted to get some feedback from all of you, perhaps. We found that there are a number of cases in which counties are saying, oh, well, we're going to house people and we're going to have some offsetting funding as a result. And yet these counties are in fact creating a worse overcrowding situation by doing that. And this is not supposed to be happening, but the agency that's supposed to oversee overcrowding issues in the jails is the Department of Health and Human Services, and they seem not to have been very active on this front. Do we have a concern there that the state is kind of playing hands off and letting counties do what they want? I know Jessica probably can't answer that.
I think there's always a concern as an advocate about the lack of care and concern for people who are incarcerated from local electeds, from state electeds, and from our national elected officials. Like, this is a problem across the board, the lack of care and concern for people who are incarcerated. And so it's not surprising ever, but it is very well practiced. And so it is the pattern and practice of jails and prisons to disappear people and their issues and silence them by warehousing them and their issues. And it's just a way of not dealing with society's, to Amanda's point, she talked about how this historically has been happening and it's still happening today. And so I guess for me, the Department of Health and Human Services, I mean, there are so many things that a jail administrator is supposed to be making sure happens, right? And we've seen an uptick, as I can speak for Mecklenburg County, especially in the amount of people who are dying in custody. And we see that they have been failures on the staff's part to do the required checks of people who, not just the regular check that you do on a person, but when you have identified someone through a screening that they are mentally fragile and could be at greater risk for suicide, they're not even watching those people. And so staffing is an issue inside of the jails, and the staffing is an issue inside because of what they are prioritizing. They're not prioritizing the health of the staff or the people. They are prioritizing the continuance of the status quo, business as usual, despite there being a deadly pandemic, despite there being public outcry for change, and despite evidence, there is empirical evidence that shows that it's just not working. It's just not getting us where we want to be, despite the continued investment in. And if our elected officials were managers of a hedge fund, we would have divested from their hedge fund a long time ago, because they are not giving us a return on our investment, which is their responsibility. They are fiduciarily responsible for our money. If they were boards of directors, we would fire them. I mean, there would be so much happening if they were like us, like normal people working every day. But they are shrouded. Both elected officials and unelected officials are shrouded in the state's secrecy and the lack of willingness. It's the violent inaction is what we've named it over at the ACLU. It's the let me push around some papers and look like I'm doing something and make a whole bunch of pontifications that I'm actually not going to do. Let's create a task force to address it, not really do anything, just have a task force with a lot of recommendations that never get implemented. And it looks like I've addressed it when I haven't really done anything but push papers around. And so that is a constant thread that we see when we're talking about incarceration as it relates to elected and unelected officials and how they view the importance of incarcerated people.
Let's say that we had somebody who got elected as a person who is a person of goodwill, wants to see some changes, recognizes there's some problems with the things we've talked about, maybe doesn't agree with every one of the points that have been raised because different points have been raised, but a sheriff, a county commissioner, a state legislator, what do you say to them if they say, what can we do at whatever level I'm at? What can these people do at their individual levels to try to make improvements in the system that is realistic and viable short-term in this country or in this state?
If I may jump in quickly with a result from the reporting that I did, there's some allocation of funds that are coming in. So North Carolina was one of the states that participated in a lawsuit against distributors of opioids, and that resulted in a pretty significant settlement. Millions of dollars are coming into North Carolina, going to be distributed around to the counties over the next several years. Surrey County is deciding to use those funds to dedicate it to a substance use intervention program. And so that's just one thing that the county commissioners, led by county manager, are deciding to do in that area. In Orange County, they are deciding to use the funds they get from the ABC Commission to invest in a criminal justice resource department. And that department is doing pretrial release, looking at who's in the jail, whether or not they need to be there, creating a court specifically for failure to appear, so that people aren't arrested on a first-time failure to appear. And so there are certain ways that, especially at the county level, we're already seeing places take pockets of money that they're getting and dedicating that to substance use intervention programs or pretrial release programs. So there's certainly ways that we're seeing people in the state already allocate funds to divest in ways from jails.
We have a project that's open right now. It's called the North Carolina Rural Jail Project. It's open from multi-stakeholder teams in any rural community to apply, where we'll work with them, developing qualitative and quantitative data to help them understand how their system functions and make sure that their jail is being used efficiently. We have already had a number of applications submitted, and stakeholder teams can apply through November 12th. So it's an opportunity that's actually available right now. There are also evidence-based models that are available. We have a lot. We open source everything on our website. There are a lot of tools and resources that are available, whether you're at the county commissioner level, or you're the sheriff, or you're the police chief, or you're in the court system. If people want to look at making improvements in their systems to promote public safety and healthy communities.
Any ideas in the legislature that could be tackled to address some of these? For instance, mandatory sentencing is one that seems to come to mind that they could address in places where there still are mandatory sentences for some nonviolent crimes. Things like that. Are there other issues that they could be looking at?
Yeah, I mean, so many. I mean, if you just look at the amount of people like right now on death row and how many of those people had an all-white jury, right? Like, we know that death row is very racially disparate, that over 50% of the people on death row in North Carolina are Black. A lot of them were in rural counties with all-white juries. And so, like, that could be addressed. The juveniles who are life without parole, who could be addressed. Like these are children who under the new law raise the age, I mean, may or may not, right? There will be consideration. There may not be this automatic, relegation to life in prison. And so I think there's lots of things that could be done, but I just wanted to push back on something you said, Frank. You said, what's realistic? And I just want to say, if incarceration is realistic, then everything, literally everything else is realistic. And so like we've gotten real comfortable with incarceration, and we seem to be really uncomfortable with people's liberation. And so if this is the land of the free and the home of the brave, then I would just suggest that we free the people so that they can be brave. You can't be brave while you are locked down. And so like that, it should be the end goal, is for all people to have what this American dream, promised us, which is life, liberty, the pursuit of happiness. I'm not sure how you can do that from behind a wall.
That's a fair point. And to be clear, when I said realistic, I was thinking about likely in terms of, thinking about the election we saw yesterday in Minneapolis, where there was a city where there had been clear calls for change, but it was rejected by the voters. And I'm not saying that was the right outcome by any means, but I'm just saying, I guess part of the question I would, as we're trying to wrap up in just a minute, any ideas about how we move public education and public knowledge on these issues to help the voters to get to where they need to be to make those changes?
Yeah, I'll also add to that. I think, especially I think the Minneapolis example, I think we wouldn't be having this conversation if like that wasn't going on. I mean, part of it is also, right, like the bigger sort of ripples of like these conversations. I mean, I feel like some of us have been talking about jails to ourselves for such a long time. And there's people on this call who have been doing that work outside of jails, welcoming people back into the communities. And so I think it's not politicians, right? Like I just, like, as Kristie said, they're comfortable with what's going on. I think even in those 2018 sheriff elections, when we saw, right, sheriffs who were committing to certain things, those folks have still had jail deaths, right? Like there's something that I think it was already been said, that the system is well, I think people say the system is broken. I think it's meant to do what it was built to do. And so I do think that there's a lot of this that I think our plea should be to community members, not who are going to have to push those elected officials, right? The work doesn't stop once those folks get elected. And so I think that there's a lot of that education of just of encouraging folks to participate, and also creating these public spaces where folks can have those conversations, right? So, I mean, again, as I mentioned before, going to a county commissioner meeting and raising your voice, in some places, in some counties in North Carolina, you get arrested for that, right? And so I think some of the work that I think being politicized in Durham, and thinking about groups like the jail investigation team, which is not doesn't work, doesn't sort of meet anymore. But those were the folks who I think were first pushing some of these big concerns in Durham, right? And so I do think that it actually means for us advocates, or for folks who feel like they can say that they're advocates, to actually be in community with people and sort of creating that piece, because obviously people who have gone through the system, they know what the reality is, right? They don't need to be told that the sheriff is the one who's going to be in charge of their life if they're incarcerated. And so it is, I guess, the other folks who we depend on to vote people in or out. But I also think it means sort of coming together as community members and having these conversations outside of, right, these spaces, right? Doing that sort of deep canvassing that so many organizers have been doing, the folks in Minneapolis were doing, right? So we sent some folks from one of the organizations I'm part of to do some of that door knocking too, right? So it is being about being in solidarity and recognizing that those conversations, the conversations in Austin that have been happening around defund campaigns, those are the reason we're here, right? Like, I think we wouldn't have this sort of this like consciousness about these things if those things weren't taking place.
Thank you to all the panelists. We need to wrap up as our time is up, but I want to thank you all for what's been a very lively and enlightening conversation. And I want to thank everybody who's attended today. I want to remind everybody, please watch for an email with links to what we've discussed and the recording today's session. And you'll also find our daily newsletter in your inbox. We invite everybody to please support Carolina Public Press. We are a 501c3 nonprofit news organization. We rely heavily on the support of people like you. Make a gift to carolinapublicpress.org. You can become a 10 for 10 member in honor of our 10th anniversary by pledging $10 a month to support CPP. Thanks to everybody.
Yeah, thanks to everyone. I really appreciate your time.